News Desk, many thanks for staying with us. We continue with one of our top stories at this particular hour, and it is the polio campaign being spearheaded in the county of Nairobi. The Ministry of Health has launched a campaign to immunize over 800,000 children against polio in the county of Nairobi as from the 9th to the 13th of May this year. Now, this follows the discovery of poliovirus type 2, or the vaccine-derived poliovirus type 2 at a sewer in Eastleigh estate. In March this year, the virus, similar to one discovered in Somalia last October, presents a high risk of infection to children and may cause paralysis. Our medical correspondent, Dr. Maskorir, now joins us live here in studio to just give us the quick facts about polio and really tell us what we are staring at currently as a country as far as the vaccine-derived poliovirus type 2 is concerned. A very good afternoon to you, Dr. Masi.
Good afternoon, Akisa.
Yes.
Now, as you've noted quite clearly, is that the virus that was identified was a circulating vaccine-derived poliovirus. This is not like the wild poliovirus. Yeah. This is a totally different one, which is from the vaccine. Remember that the vaccine that the children receive is a weakened form of type 2 poliovirus. So once it's excreted from the system, then it goes into the environment and the sewer system. And where there's poor sanitation, this is now where it's likely to manifest and can infect. And now how it infects is that when there is low immunization or no immunization at all, or that the children around that area are under immunized, then they are at risk of contracting this virus, and they may actually get polio. Now, of note about polio is that it affects mainly children who are under 5 years of age, and 1 in 200 infections may lead to irreversible paralysis. And we know that, and we'll see from our graphics, that polio, one of the notable signs of polio is the paralysis. This, apart from the other constitutional symptoms like fever, fatigue, they get paralysis. And 1 in 200 infections may cause paralysis. And 5 to 10% of these children may actually die if this paralysis ascends to their breathing muscles. Now, the wild polio virus that I was talking about has decreased by over 99% since 1988. And in 2017, in our next board, we'll see that in 2017, only 22 cases were reported. Now, 16 million people have so far been saved from paralysis. This is through the continued immunization across the world, not only in Kenya, and 16 million have been saved from getting paralysis that is occasioned by polio. Now, a failure to eradicate polio may cause up to 200,000 new infections in 10 years. That is globally. Within 10 years, 200,000 people will be at risk, or children will be at risk of getting polio if it is not eradicated. And the WHO has estimated that by 2018, this is this year, it would cost about $5.5 billion to eradicate polio globally. Now, of note is that in January of this year in Banaadir province in Mogadishu, Somalia, there were 3 strains of the circulating vaccine-derived poliovirus type 2 that was isolated. And the same vaccine was isolated in March in Eastleigh, that is Kamukunji area of Nairobi, Kenya. Of note is that with this particular circulating vaccine-derived polio, no acute flaccid paralysis, which is the signature sign and symptom of polio, none has been reported of all these cases. Now, the country is obviously now getting back into starting immunization, into continuing with the various eradication efforts, and because of this circulating vaccine-derived poliovirus that was identified. Akisa.
Right, thank you very much. Those are the quick facts on polio. Dr. Maskorir is our medical correspondent here on KTN News. Now, joining us in studio, still on that same conversation, is Dr. Supa Tunje. She is the Treasurer General at the Kenya Medical Association, and as well as a pediatrician. Thank you very much for making time for us here on KTN News Desk. As I said when we were beginning the program, Kenya was this close to being declared polio-free before this virus was discovered in Eastleigh. What then does this mean for us as a country?
That is very true. Kenya was supposed to be declared free of polio this year, 2018. So this detection of a virus in the environment may look like it's a setback, but the good thing is that we are still able to eliminate this circulating virus with the multiple vaccination that is going to take place, and that is why we require this supplementary immunization program, so that then we can make sure that we have every child under 5 years of age vaccinated against the virus. So we still have a chance to make sure that polio is completely eradicated.
So it is a setback, but not a major one?
Not a major one, because Kenya has the capacity to be able to eradicate it, yes.
There's conversation that this is a vaccine polio type 2.
Yes.
Yes. I just want you to take us through, for the sake of our viewers, what is the difference between polio type 2 and the vaccine-derived poliovirus type 2, and what are we dealing with right now?
Okay, so just to make it clear, is that polio, we have 3 types. There are 3 strains. We have type 1, type 2, and then we have type 3. Previously, the country has been immunizing against the 3 types, which is as I have mentioned, the type 1, 2, and 3. And recently, 3 years ago, we changed from the 3 variant to the 2 variant, which is type 1 and type 3. Yeah. And currently now what has been detected is the circulating vaccine-derived poliovirus type 2. Now, what it means is when a child is vaccinated against this against polio with the vaccine type 2, is that what happens is the vaccine, once it gets into the system, then there's a form that it multiplies. It actually changes the form, and by the time it is being shed into the environment, it is totally different from what you have in the like what was used to form the vaccine. So what you have is, yes, vaccine derived, but it's not the same kind of a strain with what is used to manufacture the vaccine. But it equally has potential to cause disease, just like the wild type virus. Yeah. And therefore, that is why it is very important to have this vaccination and make sure that every child is vaccinated against the circulating virus. So whichever type is found during the surveillance, it doesn't matter. The measure remains the same, that you have to vaccinate.
Okay.
Yes.
With this virus rearing its head back, given the kind of eradication efforts that have been put in place for this particular cause, I mean, do you think immunization is enough, or do we need to do more as a country?
Absolutely. When it comes to controlling diseases, contagious like polio, the other measures remain the same. Like, you have to ensure good sanitation, hand washing practices must be promoted. But the good thing is that this particular type of polio virus can be eradicated with just the monovalent type 2 vaccine. So it is very effective. It is once we are able to reach the target population, we'll be able to eliminate it. So, but requires multiple vaccination, 2 to 3 times, and we'll be able to eliminate it.
What are the dangers involved with this virus now being detected? What are the dangers in the event that one of the children gets infected by it?
Well, polio is a highly contagious virus, and therefore any single infection poses a risk to the population. That means if you have any child infected, they can easily transmit to the rest who are unvaccinated. And that is why we must make sure that we stop this transmission as fast as possible. And the dangers remain the same, is that the symptoms will be similar to that of wild virus. They're those who will end up with paralysis, and therefore this kind is yes, it is vaccine derived, may not be the same, but in terms of the symptoms that may occur, the effect will be equally similar. So it will cause paralysis just like the other type. Yes.
So then, what do we expect to see this week, being the campaign for Vaccination Week?
So the first round of campaign is to reach to over 800 children in Nairobi County. Nairobi County, because that is where the virus was isolated. But then after that, an analysis will take place then to see how the other counties then can be incorporated. Mainly it is the areas which are endemic or at risk of having this kind of movements and the kind of risks that lead to the transmission of polio in our country. And these are the counties identified is along the borders and where we have immigrants coming in to settle. And so we expect in the coming 1 week to have vaccination within Nairobi County. Then thereafter, next month, to get into the other counties around Nairobi.
In the past, during times when there have been campaigns for vaccination of polio, there has been a lot of noise that has been made, especially by the Catholic Church, on how safe these vaccines are. Talk to us about that, even as we track the progress the country has been making as far as polio is concerned.
I think mainly the kind of public controversy may come in with if information is not given to the public appropriately. And this time around, I think the Ministry of Health has tried to put all stakeholders and to explain why do we need to do this vaccination, why is it important that children must be vaccinated, what does it mean to us as a country to have polio eradicated. So because vaccines are safe, and vaccines actually save lives, and they save they reduce the disability that may come because of these preventable diseases, and therefore I think mainly because if we put everybody together on the table, then we are able to have the same information. And this time round, I think we should expect a success of the campaign. And the vaccine preparation or manufacture goes through a very lengthy process to come up with the vaccine. And it is made in such a way that it is safe. It should not cause any harm.
So you're confident that no controversies will erupt this time around with this campaign?
Yeah, we hope so.
We hope so.
Yes.
Thank you very much for joining us here on KTN News Desk. Dr. Supa Tunje is the Treasurer General at the Kenya Medical Association, as well as a pediatrician, talking to us about efforts that are being made currently to immunize children against polio as it rears its head back in parts of the country. Once again, thank you very much for joining us here.
Thank you.